Welcome to the Oncology Day Unit at Toowoomba Hospital. A diagnosis of cancer can be a difficult and challenging time for you and your family. Supporting you through this journey requires a whole treating team, including doctors, cancer care coordinators, nurses, pharmacists, and allied health. There are a number of support services available if you need them. This video will provide you with a general overview of the side effects from chemotherapy and how to manage them. On your first treatment visit, we will cover more specific side effects related to your treatment protocol. Your doctor will request a blood test to be taken 1 to 2 days before each of your treatment appointments. On the day of your appointments, leave yourself enough time to find a car park and do not book anything else on the day, as sometimes there can be delays. Cancer cells are cells that divide rapidly and grow out of control. Chemotherapy is the use of drugs to kill or slow the growth of cancer cells. Chemotherapy can also affect healthy cells, such as blood cells, hair follicles, cells inside your mouth, bowel, and reproductive organs. When normal cells are damaged, side effects can occur. There are many chemotherapy drugs, all with different side effects, and our bodies can respond differently. Most side effects are temporary, and precautions are taken to prevent or reduce side effects. You may experience each cycle of treatment differently. Your doctors and nurses will ask you at each treatment visit about any new or worsening side effects, so it's important to advise them of these changes. Chemotherapy can affect your blood cells and cause anemia, bleeding problems, and increase the risk of infection. Red blood cells carry oxygen around your body, and reduced amounts of red blood cells can make you feel tired, dizzy, or short in breath. White blood cells fight infections, so with low levels, this may increase your risk of catching colds or other infections. Any scratches or cuts may get infected more easily. Platelets help blood to clot and to prevent bruising. With lower levels, you may bleed more if you scratch yourself, or you may notice you bruise easier. These blood cells will be monitored on routine blood tests before each treatment to ensure that it's safe to proceed. If you have any concerns relating to these, please contact your treating team. Take your temperature routinely. We recommend 3 times a day when you're on chemotherapy, and more often if you feel unwell. If your temperature is 38 degrees or higher, or you have other signs of infection, you must go to the nearest emergency department immediately. This is considered a medical emergency. Do not take paracetamol if you have a fever until you have presented to the emergency department for assessment. Paracetamol may mask or hide an underlying infection by lowering the temperature and making you feel better. It will not correct or treat the infection. If you do take paracetamol regularly for pain or a headache, ensure that you take your temperature before each dose. It is important to seek medical attention for any of the following: a temperature of 38 degrees or higher, chills or shivering, feeling hot and sweaty, cough or flu symptoms, sores in or around your mouth and throat, burning or stinging when passing urine, loose or watery bowel motions known as diarrhea, unusual vaginal discharge known as thrush, any wounds on your body that are red, swollen, oozing, or tender, especially around your PIC or portacath site if you have one. If you are unsure, please contact a member of your treating team. To reduce your risk of infection, please ensure that you wash your hands regularly, particularly around preparing and eating food and after using the toilet. Avoid family and friends who are unwell. Be mindful when you're in crowded places. Remember hand hygiene and wear a mask. Your white blood counts may be low, increasing your infection risk. Wear gloves when gardening, especially if using potting mix. Eat freshly cooked foods. Take care when shaving or using sharp objects to prevent injury or bleeding. Some chemotherapy drugs make you more nauseated than others. Often the best way to manage nausea is to prevent it from starting. Your doctor may prescribe anti-sickness medication, so it's important to take these as directed to prevent vomiting and dehydration. Other ways to manage nausea include eating small, frequent meals, snacking on dry foods, foods with ginger, or eat what appeals to you. It's important to drink plenty of fluids to avoid dehydration. Dietitians are available for further advice. Please present to hospital if you're unable to keep any food or fluids down. Diarrhea is more than 4 loose, watery bowel motions a day and is a common side effect of cancer treatment. Choose bland foods and foods with high protein, high energy. Avoid spicy, fatty foods and limit alcohol, fruit juice, and dairy products until the diarrhea settles. If severe and uncontrolled, for example, more than 4 bowel motions above your normal daily limit, please notify someone in your treating team for further management to reduce the risk of dehydration. In some cases, you may need to present to your nearest emergency department. Another common side effect is constipation. Constipation is infrequent bowel motions or bowel motions that are difficult to pass. Constipation needs to be treated early. It is important to let your treating team know if you have not opened your bowels for more than 2 days, or if it has been longer than your normal routine. To avoid constipation, try to eat more high fiber foods, drink 2 liters of water daily, and do some gentle exercises. Your doctor may recommend laxatives. Avoid enemas or suppositories due to the risk of bleeding and infection. Chemotherapy can damage healthy cells in the mouth and cause soreness, ulcers, or infections. It's important to maintain good oral hygiene. We recommend using homemade mouthwash 3 or 4 times per day. 1/4 teaspoon of salt or bicarb in 1 cup of warm water, or use any alcohol-free mouthwash. Use a soft toothbrush and clean teeth twice a day. Some chemotherapy drugs may cause your skin to develop a rash, become dry or itchy, or be more sensitive to the sun. Use moisturizing cream and be sun safe. Your nails may become darker, develop ridges or white lines across them, or become brittle. Keep your nails clean, trim regularly, and moisturize your cuticles. Your nurses can provide more information if you're concerned. Please notify someone in your treating team if you develop a rash that covers more than 30% of your body. Feeling tired and lacking energy is the most common side effect of chemotherapy. To help manage fatigue, rest between activities, accept help from others, engage in gentle exercise, and eat a healthy, well-balanced diet. If you find it hard to do everyday activities, let your treating team know. Plan your day around how much energy you have. Thinking and memory changes can be caused by chemotherapy treatment, medicines, fatigue, and sleep problems. It's also known as chemo brain or chemo fog. Changes such as word finding difficulty, forgetfulness, difficulty multitasking, and slower processing speeds can occur. Some management strategies for day-to-day tasks include keeping reminders, calendar, diary, post-it notes, and taking a support person to important appointments. The chemo fog improves over time. Inform your treating team if these changes are affecting your day-to-day life or work. Cancer and chemotherapy both place extra demands on the body. Eating well during chemotherapy can help your body cope better with the side effects and aid your recovery. It can help improve quality of life by giving you more energy, keeping your muscles strong, helping you stay a healthy weight, and boost your mood. Be aware that loss of appetite, taste, and smell changes can affect your oral intake. You may need food with more energy and protein. Eat food that is prepared safely. Wash raw fruit and vegetables. Avoid raw, rare, partially cooked seafood, meats and eggs, and defrost food in the fridge. A referral to a dietitian can be organised if you're concerned about your eating intake and weight. Hair loss does not occur with all chemotherapy drugs. Hair loss depends on the type and dose of chemotherapy you receive. Some people lose all their hair and others find that it becomes thinner. Hair loss usually starts after cycle 2 of treatment, but can gradually start after your first dose. It's important to protect your scalp with hats, wigs, or turbans. Please ask your nurse for more information, and resources are available to you, including the National Cancer Support Workshop Look Good, Feel Better program. Chemotherapy can affect your sexuality and fertility in emotional and physical ways. These changes are common. Good communication with your partner during this time is important. Your ability to have children may be affected temporarily or permanently. Before starting treatment, talk to your doctor about how the treatment might affect you and what options and resources are available. It's important to use some form of barrier contraception during treatment to protect your partner from the chemotherapy drugs that may still be inside your bodily fluids. Pregnancy should be avoided as these drugs may also harm an unborn baby. Talk to your treating team immediately if you become pregnant. Peripheral neuropathy refers to the damage of peripheral nerves located away from the centre of the body, such as in the hands and feet. These nerves help with feeling, movement, and balance. Nerve cells, unlike other cells in the body, are not easily repaired or replaced if badly damaged. Not all chemotherapy drugs cause peripheral neuropathy. If you do have symptoms, the severity can vary widely. Your treating team will ask you about symptoms each treatment. There is little risk to family and friends during and after your chemotherapy treatment. Traces of chemotherapy drug can be in your urine, feces, vomit, bile, and sweat for up to 7 days after treatment. You will be given a spill kit and advice on what precautions to take at home so your family members don't come into contact with the bodily fluids and chemotherapy drug. More details can be found in the Cancer Council booklet, Understanding Chemotherapy, which will be given to you on your first treatment visit. Here are some helpful reminders on what you should be aware of while undergoing treatment. Seek medical attention or advice immediately if you have a temperature of 38 degrees or higher. Have blood tests taken as directed 1 to 2 days before your appointment. Ask your treating team when your next appointment is required. We will try and keep to the schedule as best as we can, and we apologise for any delays. This can be a difficult time for you and the people that care for you. It may affect your physical, emotional, and financial well-being. There are several support services available to help you. Please let us know if you would like a referral.